Everyone, welcome. My name is Christina Nguyen. I use she and her pronouns, and I'm the ACLU of Oregon's Membership Engagement Officer, and also your host tonight. Thank you for joining us today to discuss how COVID-19 is impacting Oregon's jails and prisons. This webinar is being recorded, and we can share it with you all and for folks who may not be able to attend tonight on our website. I want to start off by thanking our ASL interpreters, Lydia Pickard and Tammy Richards. If you prefer to have the interpreter's window large and the rest of the participants' windows smaller, you can use the pin feature to keep one window larger than the rest. Lydia and Tammy will share interpreting tonight, so you will switch your pin speaker throughout the program. We hope you'll ask questions throughout the event. To do so, type your question in the Q&A box and not the chat box. The Q&A box is located at the bottom of your screen. It looks like a box with the letter Q on it. And if anyone wants ASL interpretation to ask a question, please let us know by sending a message in the chat box or Q&A. After the webinar, a survey about your experience will open automatically, and we want to know how we did, what we could do better next time, and what issues you're interested in hearing about at a future webinar. If you happen to get disconnected, you can use the same link to rejoin. And now I want to give our speakers an opportunity to introduce themselves. Vanessa, will you go first?
Yes, thank you, Christina. Hello, everyone. My name is Vanessa Sherrod. Pronouns are she and her. I'm a mother of 3 wonderful children, currently in college, and I live in Salem. As a formerly incarcerated woman, it is important to work to create change for people in prison and their children. I have done this work through the Family Preservation Project, a vital program through the YWCA that strengthens families and reduces trauma for children whose mothers are incarcerated, and plus with the ACLU of Oregon. I have been in touch with many women who are currently incarcerated, and today I will share some of what I have heard from them. Thank you for inviting me.
Thanks, Vanessa. How about you, Maile?
Thank you, Christina. My name is Maile Browning. I use she, her pronouns. I'm the Legislative Director of the Oregon Criminal Defense Lawyers Association, the OCDLA. We have approximately 1,200 defense attorneys as well as investigators statewide who represent adults at the trial level and appellate level, youth in the juvenile justice system, parents whose children have been removed, and children in foster care. Our attorneys are going to court for release hearings, dealing with how to communicate with their clients in jails, and trying to transition their clients out of prison. I also serve on the ACLU of Oregon Lawyers Committee. Thank you for having me.
Thanks, Maile. And finally, my colleague, Kelly.
Good evening, everyone. My name is Kelly Simon. I use she, her pronouns, and am currently the interim legal director at the ACLU of Oregon. I've been an attorney with the ACLU of Oregon for 5 years now and been involved in all of our jail and prison advocacy in those 5 years. That includes our litigation against Oregon Department of Corrections to protect the rights of transgender prisoners to access medical care, our litigation against the Douglas County Jail and its medical care provider to ensure that medication was being appropriately administered, as well as advocacy in the legislature to ensure that people who are incarcerated are not being denied basic dignities like access to simple things like menstrual hygiene products. One thing that I've learned so far in this work is that Oregon's prisons and jails are deeply inhumane places on a good day. I am so thankful that you all are joining us for concern for this issue, because we are deeply concerned about the lives of those who are incarcerated here. During this pandemic, we must do everything that we can to ensure that people locked in these institutions are being heard and know that their lives matter.
Thanks, Kelly. And thank you again for everyone who's joined us tonight. I'm thrilled to share that we have over 80, close to 90 people joining us live into this webinar. And all that said, I'd like to hand it to Kelly to dive in.
Okay, so let's set the stage with what we know first. First, we know that there are over 14,000 Oregonians, many who are elderly and already in poor health, who are currently confined in very unhygienic, small, and densely populated cells in our jails and prisons. Our justice system cannot afford to stay stagnant during this pandemic, but Oregon is. We also know that COVID-19 is not an equal opportunity disease. Barriers like barriers to access to healthcare, discrimination and bias in the criminal justice system, the history of exploitation and exclusion of people of color in our economy, among other systems of racial oppression, have caused Black, Latinx, and Indigenous people in particular to be hit hardest by this COVID-19 pandemic. So we must address this pandemic through a racial justice lens. While Oregon is doing a good job of collecting and reporting accurate data on rates of infection and health outcomes in communities of color, it's failing to consider the racial justice implications of ignoring the prison population. We know that of the thousands of Oregonians stuck in our state prisons, a disproportionate number are Black, Indigenous, and Latinx. That is because people of color in Oregon have been disproportionately arrested, prosecuted, jailed, and imprisoned. Oregon also has several mandatory minimum sentencing laws that are disproportionately wielded against people of color. The ACLU has created what we call a 50-state blueprint that shows us that if many of Oregon's mandatory minimum laws were changed, our prisons would have nearly 7,000 fewer people inside of them, and our state would be saving over $584 million. Laws like Measure 11 are now handcuffing the state in the middle of this public health crisis. This virus cannot be locked in or out of our prisons. Huge numbers of people cycle in and out of these prisons every day, including corrections staff, delivery workers, people coming in from local county jails, people in custody being moved between facilities. On any given day, there are thousands of people living and working in each of the institutions. The risk of COVID hotspots in our prisons is something that implicates the health of all of us. If an outbreak emerges and spreads through one of our prisons or our jails all at once, as public health experts have warned us they will, unless density is dramatically reduced, local communities could be hit with high numbers of serious cases all at once, overwhelming that community's resources, medical resources in particular. We are starting to see just how threatening this virus is in a correction setting. We only need to look to Ohio for an example. When Ohio committed to mass testing of people in their custody, they found there was over 70% infection rate. The message to our governors, the White House, other stakeholders is clear. Reducing density in our prisons and jails is a matter of life and death for our communities. Here, the Oregon Department of Corrections is currently reporting 33 COVID infections. 15 of those are staff, and 18 of those are adults in custody. We can't wait any longer.
Thanks for that background, Kelly. Vanessa, you've been in touch with several women who are at Coffee Creek, Oregon's only women's prison in Wilsonville. What have you heard from them during this pandemic?
Yeah. First, let me explain what the prison is like inside. While I will talk about the women's prison, everything I am sharing is pretty much the same for the men's prisons. Currently, the women live in dorms with about 120 women. With so many people together in one room, you can imagine how stuffy these dorms can get. Sadly, outdoor time has been reduced in response to COVID-19. Usually women have a chance to go outside for several hours 3 times a day. Now they only have 45-minute windows 3 times a day. So a majority of the time, their time now is inside. The dorm bunk beds are about 3 feet apart. Social distancing is really impossible, but what the prison has done is require everyone to sleep head to foot alternating. During the day, women can go to the day room. It is a 400 square foot room, and it is now limited to 50 people at a time due to COVID. Some So most of the women are in the dorm then most of the day. They are told to keep 6 feet clear of one another, but as you can guess, this is nearly impossible to do.
Wow. Vanessa, what have the women told you about how they're feeling?
The worries are at an all-time high for the women inside and their family members. They know it's impossible to follow social distancing guidelines in the prison. They wonder how medical will be made available to them if there is an outbreak of the COVID-19 inside. They are scared because they don't receive much health care as it is. Like all of us, they have constant worries about their kids and their family members that are dealing with the pandemic at home. And now, on top of everything, they really can't explain to their loved ones how they will stay safe themselves. What they do know is that every person in Oregon that goes to prison comes through intake at this facility before they go to their permanent placement. So there's a lot of chances for COVID to get in. They also know that patients who are infected with COVID are being brought from other facilities to their infirmary at Coffee Creek, and this is causing a lot of distress. Some of the women have recently been told that they're not going home soon as planned. For these women and their families, it is particularly heartbreaking. This happened both because the early release programs have all been suspended and because women are having trouble finding transitional housing due to COVID-19 shutdowns.
Thanks, Vanessa. Maile, despite the warnings from experts, with only a few exceptions, Oregon has not released people from prison as a result of this pandemic. What are some of the challenges here?
Well, I think that some of the challenges may be related to public perception. So earlier this month, there was an article in the press about Governor Brown wanting to determine whether early transition and compassionate release of medically compromised adults in custody would be a safe and effective way to reduce the likelihood of COVID-19 spreading through our prisons, yet done in a way to ensure public safety and to not overburden counties from a supervision, shelter, and healthcare standpoint. The governor wanted to know the numbers of adults in custody in some select categories, such as adults in custody with an approved residence post-release, and those within 8 weeks of release. Also, non-Measure 11 adults in custody who are medically vulnerable, those who are over 60, and those who have served half their sentence and who are within 6 months of release, and those who are within 6 to 12 months of release. However, the district attorneys were quoted in the press as responding by fear-mongering, saying that there were significant public safety concerns about mass release of violent convicted criminals, even though the so-called mass release was never being contemplated. So to be clear, our public safety system is skilled and experienced at safely transitioning people out of prison who can be safely transitioned, and they work collaboratively with victim advocates towards safe and timely solutions. So after that attack from the DAs and the Oregonian, Governor Brown appeared to have stepped back entirely from using any form of case-by-case early transition as part of the overall plan to reduce COVID-19 within the Oregon Department of Corrections.
Vanessa, we know that the vast majority of people transitioning from prison back into communities have homes and families to return to, and the Family Preservation Project works to support some of those families. What is the impact on this having on family members who have loved ones in prison?
Yes, it is really, really hard, especially hard on the kids who are waiting for their parents to come home. Since visitation is canceled, kids are struggling with missing their moms. One mom recently telling me how she just couldn't explain to her 6-year-old. She couldn't even control the emotion in her voice when she tried, and she knows that it's scary for her child. And for women whose release dates have been extended, one mom, her release date went from 40 days away to 5 months away. When I talked to her 12-year-old daughter, this little girl told me she lives in fear for her mom with what the news says about the virus. And all she wants is her mom to come home. And the grandma in this family told me this is especially hard for them after all the hard work her daughter has put into her recovery and self-improvement. She told me she feels like her daughter in prison is receiving further punishment because of the pandemic.
Maile, the ACLU just released a report that shows when jails, prisons, and detention centers are factored in, the projected death rate for COVID-19 deaths in our country doubles. So instead of the Trump administration's 100,000 projected deaths, the number could be more like 200,000. How are Oregon's jails and prisons handling things?
Jail populations in Oregon's 36 counties have dropped their populations on an average of about 25%, with many of them decreasing populations by as much as 40%. There are reports coming out of Michigan, Ohio, New Jersey, and Tennessee with shocking rates of COVID-19 outbreaks in prisons. Oregon was an early adopter of banning large gatherings, using stay home, stay healthy, and other policies that have helped COVID rates stay low statewide. That has contributed to lower numbers of COVID in prisons, which are a microcosm of the larger community. However, that will probably only push back the timeline for cluster outbreaks in Oregon's prisons, and it would be good to do more now. So things that can be done now include early transition for people due to be released in the next 8 to 12 weeks before they take COVID out of the institution home to their communities. There could be some sort of blue ribbon panel comprised of retired judges, possibly, to review clemency applications and move those through the process quickly. Another thing that can be done is working with the Chief Justice and legislators to address pre-trial relief and timelines for criminal cases. And finally, ensuring that there's more PPE available for adults in custody and staff, perhaps by utilizing corrections enterprises if that's not already occurring.
Thank you, Maile. Now I just want to talk a little bit about what we've done so far. Back in March, the ACLU of Oregon and the Oregon Criminal Defense Lawyers Association teamed up with Disability Rights Oregon, Partnership for Safety and Justice, the Oregon Justice Resource Center, and Sponsors, Inc. to send letters to all of these system stakeholders to warn them of the risks we have been discussing this evening. Those stakeholders included all of the 36 Oregon sheriffs, all of the 36 Oregon district attorneys, key legislators, the Chief Justice of the Oregon Supreme Court, the Oregon Department of Corrections, and of course, Governor Kate Brown. And just today, as part of a nationwide effort to truly see what's going on behind bars in our country, the ACLU of Oregon joined 34 other affiliates in filing public records requests with our governor and state prison officials. In all of these efforts, we are trying to balance our abilities to be a resource and demand immediate action. We've shared public health expertise with our concerns to ensure that the actions of our government leaders are taking remain grounded in science and are no more restrictive of civil liberties than necessary. And we continue to engage our government leaders to demand action every day. From policing, prosecution, and pretrial hearings to sentencing, confinement, and release, every aspect of this system must come under intense scrutiny for how it responds to this crisis. The well-being of our communities depends on our government officials, policymakers, and law enforcement following the guidance of public health experts with swift and science-based policy changes to reduce the justice system's footprint. We are grateful to the stakeholders who have been responsive, transparent, collaborative, innovative, and adaptable. But as you heard earlier, there's so much more to do. That's why we're going to ask you to take action.
Thanks, Kelly. We are now asking supporters to join our calls for action by sending a message to Governor Kate Brown. The governor has the responsibility and the power to act now. The action is online at aclu-or.org/govbrown. Your voices are powerful, so please speak out. speak up, and share our community action with your networks. Now I want to invite Biff Chapelo from Beyond These Walls to tell us about a resource Beyond These Walls has launched, a crisis line for incarcerated folks. Biff, have you connected?
Okay, can you hear me?
Yes, I can.
Okay, good. Sorry, there was a delay in the unmute function, but I'm here. So yeah, I'm Biff. I use they, them pronouns. I am the ED of Beyond These Walls, which is a prisoner support organization that focuses on LGBTQ incarcerated people in Oregon and Washington. Most of our work is centered in Oregon, and we do a lot of different things like we have a case management program. We connect people with pen pals. We have programs inside of prisons in Oregon to sort of connect and support LGBTQ folks across the state. And then a recent way that we responded to all of this COVID stuff was to start a crisis line that incarcerated folks in Oregon can call. And the crisis line serves a few different functions. The first function is it gathers information about COVID, about what's happening in their facilities, about what steps the facilities are taking. The second function is it offers info to them so we can give them the information that CDC is putting forward or give them the information that the Department of Corrections is sharing publicly. Because believe it or not, a lot of them are not shared that information. They don't have access to it. The third function is for us to share that info with organizations like you all, like the ACLU or Basic Rights Oregon, or organizations working to help the situation. And then the last function is basically to provide support to people that are calling. So a lot of people they're just scared and they don't know what's going on and they want support and help. And so that's the crisis line. I will totally in the comment section here put my email along with the crisis line phone number. And if anybody misses that, I'm sure you can reach out to Christina and you have permission to pass my email along. So yeah, that's the crisis line. So far, we're seeing, we're hearing from lots of people. Like Vanessa said, a lot of things that we're hearing on the crisis line. And yeah, it's really our way to link the people that are most affected with the people that are working really hard to fix things. So thanks so much.
Thanks so much, Biff, and thank you for all the great work that Beyond These Walls is doing. We will now take some questions from the audience. To do so, again, type your question into the Q&A box and not the chat box. The Q&A box is at the bottom of your screen. It looks like a box with the letter Q on it. And again, if anyone wants ASL interpretation to a question, please let us know by sending a message to the panelists in the chat or Q&A feature. I will start us off with a question from Roberta. Roberta is wondering, why isn't our governor releasing medically compromised incarcerated folks? Our neighboring governor has released 1,000, is the last Roberta's heard. Maile, can you take a stab at that question?
Yeah, thank you. And I think I spoke about it earlier. I mentioned public perception. And I really do think that is a big component of it. I think that sometimes other voices drown out other voices, and possibly the district attorney's voices and people who align with that philosophy are drowning out other voices. And that's why hearing from the public is extremely important now, to let them know that these are questions being asked by the public, they care, and demand action. So that would be very helpful.
Thanks, Maile. Kelly, do you have anything to add to that?
No, I think I agree with Maile. It very much is about public perception, and it has to do with those fear tactics that are being used. We can talk about any one of these categories of people, and what we often hear, categories of people meaning people close to release, people who are medically vulnerable, and we'll hear opposition come up with some scary story about one person that's in that category, which is a reason why none of them should get out. And it's not good policy. It's not grounded in science. It goes against what public health experts are saying we all should be doing. And it goes against what the data is telling us is a real threat to our health and safety.
Thanks, Kelly. Oh, Maile, go
Thank
ahead.
you. Yeah, I would just like to add on to that to dispel kind of the fear mongering. Department of Corrections already has systems in place and is used to releasing people safely, transitioning them, and also working with victims advocates as well. So that's a system already in place and will be utilized if the governor makes this decision.
Great, thanks, Maile. And the next question is for you as well. One of our participants is wondering, why are the release dates extended under the virus? That doesn't quite make sense.
I think we agree. And, you know, I think, again, public perception, hearing others' voices, and I think Kelly's going to chime in as well. Do you have something to say? Yeah.
Yeah, and I would chime in and kick it over to, I think Vanessa knows a lot about the ins and outs of how this is working. You know, it's not a direct, you have to stay in here longer, but it's a cancellation of programs that otherwise would allow people to move through those transition processes that Maile is referring to. So I don't know, Vanessa, if you want to speak more to that.
Yes, that's what, just to tag on to what you're saying, there's just multiple programming that that created an early release date for these ladies inside and gentlemen in the facilities, that whether it be a short-term trans leave release date or a AIP trans leave release date, and those programs have been canceled, which are eliminating those release dates. So people are being forced to stay in the prison system anywhere from 2 to 6 months more due to the cancellations of the program after receiving all the services that they were allocated and they completed or almost completed to receive those release dates.
Great, thank you all. Maile, another question for you. Do you know if inmates' families are notified by ODOC if an inmate is COVID-19 positive, or if an inmate is allowed to inform families before provided medical care? This person hasn't seen any info about the numbers in ODOCs in the news. Does anybody know if there's specific prisons in Oregon that have positive cases besides Coos Bay prison?
Well, this is something that I may actually kick over to Kelly to talk about what the ACLU has. We are asking for transparency and numbers in certain categories. I know that some of the numbers are posted on DOC's website. And then Kelly, can you talk about this?
Yeah, so the website that Oregon Department of Corrections has, they have a COVID-specific website on the just general Oregon Department of Corrections website. Those are probably the most up-to-date numbers you'll be able to find. We are hoping to get more information through our public records requests, of course. Something that I was encouraged to see more recently, they've added testing numbers as well to the website. So there's more transparency around what testing is looking like and how those test results are coming out. I think the difficulty in notifying family about health conditions is there are health privacy laws in place that don't allow the Department of Corrections necessarily to just send my information, for example, to my mom, unless I've very clearly given them written permission to do so. So I'm sure there are situations where family members may be being notified if that permission's been granted, or if there's been a specific request from someone to send that information out. But I don't think that they can't legally just share that information without that permission. In terms of specific numbers of prisons with positive cases, the one in Coos Bay, for folks on the line who aren't familiar, that's Shutter Creek. What I find really interesting about Shutter Creek is it's one of those institutions, it's a minimum facility. It's how the people living there are all really close to their release times anyway. And I think it's really sad to see that we're letting an outbreak happen in a population of people who who are on their way back to their families and loved ones. It raises the same question about why can't we get people out sooner rather than causing these delays.
Thanks, Kelly. We have a question from Rod, who is wondering how many inmates in other states have been released and how many states and cities are involved in these releases. How is it that they have been able to do it when Oregon hasn't? And finally, how are we going to do it in Oregon aside from contacting the governor, who apparently has been pressured by Oregon DAs? Kelly or Maile?
I can try to take a crack, but I don't have all the answers here. I don't know all the numbers from across the country. I believe it's UCLA has some of that information on they have a law clinic who's collecting that information. The question earlier referred to Washington. There have been over 1,000 released in Washington. The reason why things are varying a little bit, I think, are because each state's legal system's a little different. The kind of person who holds the power to act is a little different in each state. Here in Oregon, that person is our governor, which is why we're directing you to talk to her, to reach out to her, speak up, contact her office, because she really does have the power to use what are called clemency powers. So she can do that to commute people's sentences, so make their sentence shorter, to pardon people, to remove their sentence. There are all sorts of variations on her clemency powers that she can use to get people more safely housed. The bottom line here is it's impossible to safely house people the way we do it now in this moment. And so the Constitution requires that our state safely houses people when they're in corrections custody. And the governor needs to work with the Department of Corrections, who has been trying to figure this out. She needs to work with them and put a real plan in place, because we know there isn't a real plan right now.
And I'll jump in. As far as what else can we do besides having the public contact Governor Brown, I think that there are many moving parts and different organizations. So it's one thing for the criminal defense lawyers to advocate for certain things and advocate for transitioning people out of DOC. And our position and working with the other advocates of the community organizations that Kelly's mentioned will be strengthened if we can have the public do their role, which is letting them know that it's not just, criminal defense attorneys asking for people in DOC custody to be transitioned out. It's also the public who care about this, and they want that as well.
Can I jump in real quick? Something else that I think that would be helpful to reaching out to the people in the public would be to the transition homes themselves. If there's some way to make that connection where, because some of these people are losing their release dates because they don't have a place to transition to because the current order in place, if there could be some conversation around advocacy around that to open the doors where then people could then possibly be able to use the program, put that back in effect where they could transition home.
Thanks all. Judith mentioned that she's read in the Oregonian that 52% of Oregonians support compassionate release, but the Oregonian highlighted that those who were opposed, though they were in the minority. What is being done to educate the press? Maile or Kelly?
I think all of the organizations that you've heard about tonight have been engaged with various media outlets throughout the state. So we're having these conversations. I encourage everyone to have these conversations with the people in your community, because as Maile mentioned, public perception really matters here. And yeah.
Thanks. And supporters wondering, do prisoners get any free calls right now? Can prisoners make calls? Are prisoners doing laundry? Maile, do you know?
I do, and I know about the laundry services and the calls as well. And I wonder if Vanessa, because you have a closer connection, if you have some more detailed information about that.
Yes, they are receiving 2 free phone calls a week that are 5 minutes long. That is something that's been totally new for them. So they do receive the free phone calls. The laundry is not in Coffee Creek. With the connection I have there, I haven't heard anything in regards to the laundry being done for hospitals there, but I've heard something about another facility. I think it was another facility up north that was contracted to do that, but I don't know anything else about that. And then,
yeah, go ahead.
Okay, sorry. And then, can prisoners make calls? Yeah, they can make calls as long as they're not on lockdown. That, as long as they're not like confined to their bed space, which tends to happen numerous times during the week. The other time that they can make phone calls is when they are, if they're in the dorm, they have to go into the day room, which is only 50 people at a time, as I expressed earlier, and they all have the place where the phones are. They're all tightly next to each other to make those phone calls. So,
Vanessa, can I ask a follow-up question about that?
Yes.
How many phones are in the day room? I mean, are there like, when you imagine what's going on right now, 52 people in a room, 6, wow.
6
So
phone,
people just,
6 phones, and they're right next to each other, and it's actually for 120 plus people to share, but right now there's 50 people at a time being allotted to use those phones.
Thank you all. Teresa has a question. Does the ACLU evaluate the candidates running for DA in different counties in Oregon? It's important for voters to know what the candidates' views are in changing the justice system to address racism and other isms. Can I throw that to you, Kelly?
yeah, I think when I think about, again, kind of who to contact and who to call, when we're talking about these issues, who might have influence, the district attorney is somebody who we elect, and they work for us. So absolutely, I think people should be looking to their district attorney in whatever county they live in to see what they're doing in response to this crisis. And if they're not liking what they're seeing, contact your district attorney. And if you are, hey, maybe they like to hear from you still anyway. Tell them thanks.
And I would like to add on to that. I can see some of the questions are about county DAs and DA races. And Kelly brought up a good point, and I think our viewers are pretty savvy and they know that district attorneys are elected. They are elected by the people. District attorney races are extremely important. And just like contacting the governor, I think it's really important to know that district attorneys have support of the public and they want certain reform and they want certain change. So again, making that voice heard because they are up for election as well. I think that's really important.
Thank you. Laura is sharing that the DOC has only tested 117 of the more than 14,000 individuals in custody. We know that a significant percentage of people who test positive for the virus show no symptoms. The stated reason for this is that the DOC does not have adequate access to testing. Is the ACLU advocating for additional tests to be allocated to the DOC? Kelly?
Absolutely, we are. The Oregon Health Authority recently changed their testing guidelines to put a little bit of flexibility in those guidelines to allow for testing of people in kind of these close custody living situations, including prisons, even when those people are asymptomatic, depending on, there's a caveat that it depends on testing capacity. I've not heard there is incapacity to do that. And so we absolutely have been advocating that testing needs to be significantly increased. I mean, we mentioned Ohio earlier. They found over 70% of people in their state system, their state prison system, were infected when they did widespread testing. And many of those people were asymptomatic, which makes me really nervous about just how quickly this virus is moving throughout our institutions without our even knowing it. And we aren't going to know it until we take a real look and do that testing.
Thanks, Kelly. I'm going to throw the next question to Vanessa. What healthcare is available to people behind bars? For inmates who get the virus, are they treated in hospitals or at the prison?
Well, I don't believe there's actually a real true healthcare in the prison system. It's next to impossible to receive services. I do know some of the women have been, while this was all going on, like just like on the outside, but in the inside, everything had been canceled. That wasn't an emergency. And even when there is an emergency, it's depending on the CO who's working that day, or depending on the system that is in place to get connected with medical. You have to have permission to go over to medical. So you have to get someone to tell you that you can go over there. If they're not willing to help you with that, they'll tell you to send a kite, which is a piece of paper that goes through their mailing system that sometimes takes 2 days to get to medical. So if you ask me how medical is in there, it's nothing. It's nothing good for getting your needs met when your healthcare is at risk.
And I just add in that the same is true in our county jail facilities, and there's a reason why the prison case and the jail case that I mentioned being involved in the last 5 years were both medical care cases. This is a type of complaint we get all too often in our in ACLU of Oregon's intake system. There is a serious problem with the state of medical care for people who are incarcerated in this state.
I do want to add to, in regards to the medical care, that how often it changes in there makes it almost next to impossible to getting your needs met inside the system. Your doctors are constantly rotating, maybe every 3 months, and so anytime you may make it somewhere with one doctor, a new doctor comes on board and you have to start the whole process over again in regards to trying to explain what you need and what's wrong with you. So I just wanted to add that.
Thanks, Vanessa. I'm going to wrap up with 2 more questions. We have a question. Let's see. What information is the state releasing about people who have COVID-19, and is that enough? Anybody? Maile, can I toss that to you?
Yeah, and I think Kelly mentioned it earlier about what is being released. That's on the DOC website, and we don't think it's enough, and we are advocating for numbers in more categories. I think maybe, Kelly, I can kick it back to you to talk about that a little bit more.
Sure. So if you go on their website, you'll see it broken down by institution, tests done, positive, negative. I think I'm forgetting a category, but I'm sorry, I don't have a photographic memory. Go check out the website. The information's all there. And yeah, I think what we're seeing is really disheartening. Things we would like to see perhaps are a number of people who are medically vulnerable. They know all of those people. They've provided a list of all those people. So providing that breakdown by institution, where they're housed, understanding if those people are moving. So Vanessa mentioned how people are being brought to Coffee Creek to be able to have access to the infirmary that's at Coffee Creek. Seeing how those numbers are being moved as well throughout the institution, seeing how it's growing, I think would be more helpful. So having those numbers relative to dates would be helpful. There are lots of things that I think the Department of Corrections could be doing to be more transparent and helping the public have a better understanding about what's happening inside.
Thanks, Kelly. And on the note of transparency, Lori's sharing that her son is at OSP, and he's saying that there are a lot more positive cases than being reported on the website. How should the public take that piece of information?
I would encourage, did you say that was Lori?
Yes.
Lori, I would encourage you to reach out to us through our intake program so that we can, or through our intake line on our website, so that we can have a better conversation about what information you have that kind of contradicts the Department of Corrections. Also, hopefully we'll be able to get a more realistic picture through our public records requests that we filed today. Yeah, I'm not surprised that there are likely more people who are showing symptoms than are being reported as confirmed. I think one thing we've learned from the Beyond These Walls hotline is that people are sometimes afraid to talk about what symptoms they're experiencing, because that means you get put into a segregation cell. So I wouldn't be surprised if the DOC officials don't have the most accurate picture of what's happening.
Thanks, Kelly. And speaking of which, I wanted to highlight Biff's message in the chat. They have kindly dropped their information for Beyond These Walls crisis line, a phone number and an email address. They can share their flyer if you reach out to them, and also find them on Facebook and Instagram. So I am going to close us out for the evening. I want to thank you all for attending. Thank you, Vanessa, Maile, and Kelly, for sharing your expertise with us, and a huge thanks to Tammy and Lydia for interpreting for our audience. Thanks again to Biff and the whole team at Beyond These Walls. And thank you all again for joining us tonight. This webinar has been recorded, so if you want to rewatch or share with your friends, you'll be able to find it on our website shortly. We are excited to continue connecting with you here online. We will host another webinar in the coming weeks, so please keep an eye out for that date. And don't forget to take our survey, which will pop up at the close of this, to tell us how we did, what you want to learn about next time, and how we can improve. It should, again, open up after we close out. And finally, to wrap things up, we want to share a video with you that highlights recent work in response to COVID-19 from ACLU National and affiliates across the country. Before that starts, I'd like to wish you all well, and thank you so much for sticking with us. Have a great night.
So this is a situation that requires an extraordinary amount of response, and the Department of Correction at the moment appears to be treating it as if it's the flu.
I really think, Doctor, you want to treat this like you treat the flu, right?
Incarceration makes it literally impossible to engage in the kind of social distancing that public health experts are recommending.
It's really scary sitting in there. I know how fast an illness can go.
For a long time, abortion opponents have been trying to shut down this clinic, and they're hoping the COVID-19 pandemic will help them close it, at least temporarily.
It is critical that we do everything to make sure that access to abortion care is protected.
More than 37,000 immigrants are jailed in crowded facilities across the United States.
This pandemic impacts all of us, regardless of immigration status.
Any response to COVID-19 must reduce the footprint of the nation's criminal legal system.
No one should have to choose between protecting their health or exercising their right to vote.
You know, they're telling us to stay in the house, but then one of the most important times, they're forcing us to come out here.
Making vote by mail an option for all eligible voters is just common sense.
We cannot be 6 feet apart. If it breaks out in here, everybody's gonna get it.
Our prisons and jails in this country are overcrowded, they're filthy, they're unsanitary, and frankly, the medical care is pretty bad in the best of times.
You have to reduce the population. You have to let people out.
Today, the American Civil Liberties Union filed a class action petition to release inmates at Elkton,
ACLU of Ohio,
the ACLU of Georgia,
ACLU of Indiana.
The ACLU of Vermont is calling on officials to prevent the rapid spread by reducing the prison population.
We received a letter from the ACLU on the 20th. By the 23rd, we had to have a list of low-impact, nonviolent offenders to be released out into the communities.
There's not a solid response or game plan for COVID-19 in our carceral system, period.
I was incredibly disappointed to see this kind of opportunistic use of the COVID-19 pandemic for some political purposes.
The group saying abortion shouldn't be ruled elective, adding those who need them don't have time to wait.
I have to come down here today and risk my life to vote.
The last thing we want is for people to risk their health and safety when there are options available at this time for them to safely vote test without having to put themselves in danger.
Today, Google and Apple announced that they have a tracking tool that would allow health professionals to contact you if you've been near someone who has tested positive.
The ACLU says it wants to ensure any contact tracing app remains voluntary and only for the duration of this pandemic.
The ACLU of Michigan yesterday filed suit fighting for the release of immigrants detained in jails throughout the state.
Being an immigrant should not be a death sentence.
California is granting early release to 3,500 inmates.
It's such a relief to be out of the sickness, out of the possibility of dying in there.
Today, a judge in Austin ruled in favor of civil rights organizations suing to increase the availability of mail-in ballots during the coronavirus pandemic.
Federal judges have temporarily blocked some states from using coronavirus emergency orders to delay and in some cases deny abortion care.
The ACLU issued this notice asking the governor to consider 7 groups of prisoners for release.
It only takes one person in one of these facilities to test positive.
To release people whose only offense is being in the country without documents.
If it wasn't time before, this crisis is the time to act now.
We want science, not politics and not prejudice, to inform the response to COVID-19. And at the ACLU, we're going to fight to ensure that it does.